Sudden cardiac death, or SCD, is a terrifying and often unexpected event. It's defined as an abrupt loss of heart function, breathing, and consciousness, usually occurring within 1 hour of the onset of symptoms in a person with or without known pre-existing heart disease. In simple terms, the heart suddenly stops working, leading to death if not treated immediately. It's a critical medical emergency, demanding swift action to restore a normal heart rhythm and save a life. The underlying causes of sudden cardiac death are varied, but the vast majority, around 80%, are related to underlying heart disease. Coronary artery disease, where the arteries supplying blood to the heart become narrowed or blocked, is the most common culprit. This can lead to a heart attack, which can trigger an electrical instability in the heart. Other causes include cardiomyopathies, diseases of the heart muscle itself, such as hypertrophic cardiomyopathy or dilated cardiomyopathy, congenital heart defects, present from birth, electrical disorders of the heart, like long QT syndrome or Brugada syndrome, and less frequently, structural heart abnormalities or even recreational drug use. To understand SCD, we need to delve into the heart's electrical system. The heart has a natural pacemaker, the sinoatrial node, that generates electrical impulses that travel through the heart, coordinating the contraction of the heart muscle and pumping blood efficiently. In SCD, these electrical impulses become chaotic, often leading to a dangerously fast and irregular heart rhythm called ventricular fibrillation. During ventricular fibrillation, the heart quivers instead of pumping blood effectively. This deprives the brain and other vital organs of oxygen, leading to rapid loss of consciousness and ultimately death if not corrected. The root of this electrical chaos often lies in the damaged heart tissue, scar tissue, or genetic abnormalities disrupting the normal electrical pathways. Sudden cardiac death is a significant public health concern. In the United States alone, it's estimated to claim the lives of hundreds of thousands of people each year. The incidence increases with age, and it's more common in men than women. People with known heart disease, a family history of SCD, or certain inherited heart conditions are at higher risk. The actual number of cases may be underestimated because SCD can occur outside of a hospital setting and may be misclassified as other causes of death. The tragic reality of sudden cardiac death is that it often occurs without warning. However, some individuals may experience warning signs beforehand. These can include chest pain or discomfort, shortness of breath, palpitations, a feeling of a rapid or irregular heartbeat, dizziness, lightheadedness, or fainting. In some cases, there may be no prior symptoms at all. It's crucial to remember that these symptoms can also be associated with other, less serious conditions, but any new or worsening symptoms should be promptly evaluated by a medical professional. The sudden collapse and loss of consciousness are the hallmark of SCD itself. Diagnosing sudden cardiac death retrospectively can be challenging, as the event is often unwitnessed or occurs before medical attention is available. An autopsy may be performed to determine the underlying cause of death. However, in survivors of SCD who were successfully resuscitated, a thorough evaluation is crucial. This includes an electrocardiogram, or ECG, to assess the heart's electrical activity, an echocardiogram, an ultrasound of the heart, to evaluate its structure and function, blood tests to look for markers of heart damage, and potentially, cardiac catheterization to visualize the coronary arteries. Genetic testing may also be recommended, especially if there's a family history of SCD or suspected inherited heart conditions. While the primary outcome SCD is often death, specific types or classifications focus on underlying causes. These include SCD due to coronary artery disease, SCD due to cardiomyopathy, SCD due to inherited arrhythmias, and SCD due to structural heart abnormalities. Understanding the specific underlying cause is crucial for determining the best course of treatment and prevention strategies. Immediate treatment for sudden cardiac death focuses on restoring a normal heart rhythm. This involves cardiopulmonary resuscitation, or CPR, and defibrillation, delivering an electrical shock to the heart to reset its electrical activity. CPR helps to circulate blood and oxygen to the brain and other organs until defibrillation can be performed. In a hospital setting, advanced life support measures may be employed, including medications to stabilize the heart rhythm and mechanical ventilation. For long-term management, individuals who have survived SCD are often treated with medications, such as beta blockers or antiarrhythmics, to reduce the risk of future events. Many individuals also require an implantable cardioverter defibrillator, or ICD, a device that continuously monitors the heart rhythm and delivers an electrical shock if a life-threatening arrhythmia is detected. Preventing sudden cardiac death involves addressing the underlying risk factors. This includes managing coronary artery disease through lifestyle modifications, such as a healthy diet, regular exercise, and smoking cessation, as well as medications to lower cholesterol and blood pressure. Individuals with inherited heart conditions may require specific medications or procedures to manage their condition. Screening family members of individuals with a history of SCD or inherited heart disease is also crucial to identify those at risk. Public awareness campaigns promoting CPR training and access to automated external defibrillators or aids in public places are vital for improving survival rates from SCD. The prognosis following sudden cardiac death depends on several factors, including the underlying cause, the speed of resuscitation, and the presence of other medical conditions. Individuals who are successfully resuscitated and receive appropriate medical care have a better prognosis than those who are not. However, the risk of future cardiac events remains significant, highlighting the importance of ongoing monitoring and management. Recent research has focused on identifying genetic markers for SCD, developing more effective antiarrhythmic medications, and improving the design and functionality of implantable cardioverter defibrillators. Advances in cardiac imaging techniques are also helping to identify individuals at risk of SCD before it occurs, potentially allowing for earlier intervention and prevention. Furthermore, new research explores the role of inflammation and fibrosis in triggering arrhythmias that lead to SCD, paving the way for novel therapeutic targets.